Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department, joins me again. Good morning.
Good morning, ma'am.
We're starting off with some good news today. It looks like cases are headed in the right direction.
That's right. The cases after our 2 weeks post New Year are really starting to decline. I believe it was the 2nd of December. We were at a maximum. We peaked in our positive cases around 500 cases in one day. As of the 16th, our positives were 205. That's a pretty drastic decline after the holiday. So I don't think we're through the woods, but I think we've made some significant progress in how we're taking care of ourselves and how we're taking care of each other.
What about hospitalizations and deaths? Are we seeing the same trend yet?
Hospitalizations in general are down. ICU visits are down for the most part. There are a couple places that are still a little elevated, but it looks like COVID admissions are down generally as well. Deaths are still pretty steady, which is a little disconcerting. We've gone such a long period with no deaths or few deaths here and there, and it's been pretty steady since the middle of October.
There's a lot of new concern about this new strains, plural. What should we expect with that?
Well, I think we will start to see, more and more instances of that. And I think it's important for everyone to remember that this is kind of what viruses do. If you're too powerful and you kill your host and you can't reproduce, you're not doing a very good job as a virus. So these viruses tend to become more mild and more easily transmitted, and that's how they do survive. And I apologize, I don't remember the source, but someone earlier this week was saying that this will probably become a long-term issue like influenza, but it'll be a much less virulent strain, a less likely to cause death and more likely to just cause illness.
And we think so far that the vaccine that we have will still treat these new strains.
Correct. All data suggests that the new strains are still protected by the Moderna and the Pfizer vaccine as well.
What about flu season? We haven't heard anything about flu season.
Well, unfortunately, I don't have any data right at hand, but what we do know is flu season has been virtually non-existent this year, which is amazing. And I think that this is probably the lowest it's been in decades, if not, possibly in recorded flu, since we've been recording flu deaths and illnesses and things like that. And a lot of that has to do with all the measures we're taking now for COVID.
Yeah, right. So mask wearing works for the flu too. Social distancing works for the flu too.
And staying home when you're sick works for the flu as well. So.
Well, I know that you've been crazy busy working on vaccinations, making sure that our 70+ age group is all getting vaccinated. How are things going?
They're going really well. We've received a lot of positive feedback from the folks that have been coming in and getting vaccinated, which is wonderful. Really validates what we've been working on for the last year here. We are working on increasing our throughput, which means getting more people in per hour. We are working at some measures to really ramp up so that we can really start making a much larger impact in our community. We set out to do 800 vaccines last week. I think through a little scheduling hiccup, we managed to get around 750 or so. So we were pretty close. And I want to make it clear that those vaccines were not wasted. They will carry over. We have not wasted a single vaccine here, and we will not. We do everything we can to measure out what we've got. We do have a list of people prepared at the end of the day. Right now, we're not taking people to go into that list because what we would rather do is schedule to max capacity so that we only have 1 or 2 doses left at the end of the day. And so far, that's where we have been at.
Some people have experienced some delays and frustrations with getting registered. What advice do you give them if they're having a hard time finding a spot or even getting through on the website?
Sure. So, patience is going to be key. There are 5 locations here in Hamilton County with, I believe Fisher's putting on a 6th site. Everyone is increasing capacity. So if for some reason you need to stay in Hamilton County, you need to just either be patient or persistent and keep checking back. As demand increases, the state does allocate us some more vaccines. So it's possible that if you've checked safer tomorrow, that there may be appointments pop up if they ship us extra vaccine at any point. So really, it's just persistence and patience are what it's going to take to get vaccinated right now.
Yeah, and I think it's important that people remember too, you really are at the mercy of the state health department. You can only do as many vaccines as you receive.
That's correct. I mean, I could staff to do 1,000 vaccine a day, but if I don't have that vaccine, I just have a bunch of people standing around. So, and I think it's important as well for people to realize that how important that appointment system is. That we're in the middle of winter, we're all using spaces that are not intended to be medical clinics, so they're not set up to necessarily socially distance while you're queuing. So we don't want to see people standing outside in the cold waiting for their opportunity to get inside. That's why this, the getting the appointments are so important, so that we limit that, and we help safeguard your health all around, and we're helping do our part to get you vaccinated, but we're also protecting your health in other ways as well.
Are people doing a good job of keeping those appointments?
Yeah, right now we have had, I think last week, I think maybe we had 6 no-shows total. But again, with our plan to call people in, that really limits the number of vaccine we have left over at the end of the day where we're calling people. So we've been very lucky, very impressed with people's willingness to get vaccinated and their willingness to get out here and get it done.
Well, you guys are killing it, because I think we've got the second most number of people in the state as a county vaccinated so far.
That's right. We're behind Marion County, but when you look at sheer size and volume, that would be to be expected. And we're doing what we do, and we're doing what we can to help protect our people. And that's not just us; that's our partners at IU, at St. Vincent, and at Riverview as well, are all helping to step up and help get our residents vaccinated.
Well, you're doing a great job. Anything else you want people to keep in mind as we head into the week ahead?
Like we talked about, persistence and patience are going to be key when it comes to getting vaccinated. The other thing to remember is even when you've got your first vaccine, you're not fully protected. Once you've received your second vaccine and it's fully effective, you still only have 94.5% to 95% effectiveness. So we still need to be wearing the masks. We still need to be washing our hands. We still need to be socially distancing as much as possible. And if we get sick, we still need to make sure we get tested and to rule out COVID-19 as well.
Excellent. Chris Walker with the Hamilton County Health Department. Good luck this week.
Thank you.